heard of the phrase, "The purpose of our lives is to be happy"? This phrase was coined by Dalai Lama, a spiritual leader who has dedicated his whole life to benefiting humanity. Humans, we live and then we die. In some cases, some humans have underlying medical conditions that will ultimately lead to a guaranteed death. As someone who has witnessed a family death caused by a disease with no found cure, I believe that there is a way to avoid some of the underlying issues that come along with a foreseen death. Thus, voluntary euthanasia is ethical and should be legalized throughout the U.S. to further aid medical patients. In order to explain why voluntary euthanasia is ethical and should be legalized, I will address three main ideas. First, how voluntary euthanasia abides by the basic moral principles a majority of the public have. Second, how it can be considered a human right by personal autonomy. And third, what major benefits can be obtained with the practice of euthanasia for the patient. Now, voluntary euthanasia abides by the moral values exuded by the public. Independence plays a major role in our lives, especially for those living in the U.S. A recent study published in 2019 in the Journal of Philosophical Investigations by researchers at the University of Tabriz states this act of voluntary euthanasia is an out of benevolence and not malevolence in order to help patient to be rescued from intolerable pain. This kind of killing is not violating his or her right to live without satisfaction and against his or her desire and will. The patient makes their own choice regardless of what others may tell them. They don't take into consideration what the doctor prefers or what their family thinks they should do. Thus, the patient is independently making their own choice. They only consider what's happening to them, what's happening to their body, and what can or will happen to their body in the future. Second, helping others is also a moral value that affects everyone. A study published on September 30, 2014, in the Journal of Family Medicine and Primary Care by researchers at the Department of Community Medicine demonstrates how the quality of life in patients are poor and physically and psychologically strained in the way that they experience unbearable pain, nausea and vomiting, difficulty in swallowing, paralysis, incontinence, and breathlessness, along with depression, feeling a burden, fearing loss of control or dignity, and dislike of being dependent. This pain can last for long periods of time, whether it goes from days, weeks, months, or maybe even years. Sometimes the only thing you can do to help someone who's suffering that much is to let them go. Guaranteed, death is never an easy thing, but an alternative to watching someone suffer that much is to watch them die peacefully and on their own terms. Now, we're all able to exert our human rights, and personal autonomy is just one of them. Autonomy in the medical field is employed through informed consent. A study published on April 10, 2014 in Medicolegal and Bioethics by researchers at McGill University explains how, among many requirements, it demands that the patient be fully informed of all risks, harms, benefits, and potential benefits of the proposed procedure and its reasonable alternatives. Thus, voluntary euthanasia is not something that is forced by the doctor to the patient unwillingly. The patient knows what can happen to them, what other choices they have, treatments they can have, medicines they can take to last or live out their life longer. But they also know that euthanasia is not the only choice for them. Nothing is kept in the dark from the patient. Now, the ability to decide is important to everyone's life. A 2015 statistic reported by E.J. Emanuel for the American Medical Association titled Attitudes and Practices of Euthanasia and Physician-Assisted Suicide in the United States, Canada, and Europe suggests that less than 1% of deaths in Oregon and Washington are from voluntary euthanasia. This goes to show that euthanasia isn't suitable for every case and is only available in certain conditions. For example, someone with a mental illness is not a viable patient to have the option of euthanasia at their side because they're not able to give 100% of their full consent. Secondly, people in the hospital aren't even allowed to have the option of euthanasia unless they have a life-threatening disease that has no cure or they're almost ready to pass on from that disease. Voluntary euthanasia is beneficial for both the patient and the family. The patient is able to avoid feelings of loss of control and other symptoms that I mentioned previously. For example, Brittany Maynard, a woman with terminal cancer who chose euthanasia, stated her choice has given her a sense of peace during a tumultuous time that otherwise would be dominated by fear, uncertainty, and pain. Patients seeking euthanasia are aware of their choices and think of what's best for them. She knew that if she lived longer, she'd have to go through therapy, medicine, and even all the sufferings listed beforehand. And she knew she didn't want that. They know they have a choice, and they can either go with euthanasia or survive for months on hospice care. Secondly, the patient's family would have less medical bills to cover as opposed to months of treatment if they choose the action of voluntary euthanasia. Therapy is expensive in terms of hospice care, therapy, medication, and that doesn't even involve funerary services yet. In 2018, Shaman Karakashian published a nursing diet and a section in it titled Hospice Care, Healthcare Costs, saying that the mean total cancer-related cost in the last 6 months of life is $74,212. That's thousands of dollars on months of care, and that doesn't even include funerary services or the time spent being in the hospital. That can be psychologically straining as well. Now, overall, voluntary euthanasia should be legalized throughout the U.S. as it is ethical, abides by human moral values, is considered a human right, and is beneficial to the parties subject to a life-threatening disease. We all should be able to decide for ourselves and be the person that we choose to be.